Hi everyone, Dr. Andi here. It is time for our Wednesday's Facebook Live, where I will be answering all of your keto questions. I will give everyone some time to log on and to join our live session today. While we do that, I will take some time and give everybody an introduction as to who I am if you're new to Prove It, and a little bit about my background and what I do. And then I'll get into answering some of your questions. So I'm a naturopathic physician. I've been practicing up here in Toronto for almost 10 years now, which sounds like a long time when I say that. I have been personally in a practicing ketogenic diet for over 10 years. It's a foundation of my practice, a foundation of my treatment protocols. I initially started in sports medicine. I was a personal trainer, I was a dancer, and then I moved slowly from sports medicine into metabolic nutrition, hormonal balance, and also metabolic weight loss. And again, the ketogenic diet was a really large foundation of that. Our clinic up here has about 19 practitioners now. We have medical doctors, naturopathic doctors, osteopaths, and all of us really have a foundation of that ketogenic diet when it comes to our protocols and really working to help our patients. I know some of you are coming off of your reboot, which is fantastic. So feel free to share some of your comments. Tell me how your reboot went. I'm a huge fan of intermittent fasting and of the reboot and extended fasting. So if you were new to the reboot, I'd love to see some of your comments of how it went for you. I'm also happy to answer some questions about reboot and intermittent fasting. I thought I would start with that today while you guys come on and talk a little bit about the benefits of intermittent fasting, why we would want to do it, and the benefits that you see from intermittent fasting. I was talking about that a fair bit this morning actually in practice. A lot of patients are curious about fasting, why they should do it, how they should do it. I talk about it a lot as a metabolic reset. A lot of patients are going on vacation and they want to know how to maintain their health, or what happens if they deviate from their ketogenic diet. And the intermittent fasting, I tell them, is the best way while on vacation, and then doing a reboot or an extended or even just a 24-hour fast when you come back to get yourself back on track in that metabolic reset. So huge fan of the reboot. I'm hearing some great comments. Some people are saying they're at their lowest weight now, which is wonderful. Some other people saying they have amazing energy. I was talking about that this morning as well. The mental clarity that comes with intermittent fasting. So love to hear that, and love to see some of the energy, the clarity that you guys are seeing. People have lost weight but maintaining their muscle mass, so they lost some body fat, so that's awesome. So feel free to keep sharing. And I'll answer a few questions. So how often, how many days per week do I do the 16-hour intermittent fast? I encourage my patients to do that at least 4 days a week. I want them to do that 4 days a week, and then once a week I ask them to do a 20 to 24 hour intermittent fast if they really want to accelerate some of those body composition changes. But again, it's very safe. You can do that intermittent fasting daily. I personally do it, I practice it daily. And in that fasting window, that's a question I get. What can you consume in that fasting window? You can consume your ketones, MCT oil, coffee, and water. And those are acceptable in that fasting window and during your reboot as well with the bone broth. So some really great things that you can add in. But again, love hearing some of the benefits that people are experiencing. And I get lots of questions about dairy, and I think someone's asking about gluten-free and soy. So no, those are not ingredients that are included in the reboot. So you don't have to worry about that. Their products are gluten-free and there's no soy in them either. This is great. Lots of people sharing their weight loss, BMI dropping, they're losing inches, so that's awesome. Great to see that this was another successful round of the reboot. So hopefully you guys will join again. And yes, absolutely, you can add your keto cream into that fasting window. So I'm going to start to answer some of your questions. I try and get to all of them as much as I can. If I don't, I'll try and come back and answer them if possible. So let's start. What's the difference between a ketogenic diet and an Atkins diet? The difference is the macronutrient breakdown. Atkins was and in the caloric consumption. So Atkins is a very specific diet. It was much higher in protein and much lower in caloric intake as well. So there are just a few key differences. It was founded on the principles of a ketogenic diet, but they did encourage much higher protein intake in there as well. So there are a few key differences, and the ketogenic diet is not a severely calorically restricted diet. Although your calories might decrease if you incorporate the intermittent fasting. Again, the goal isn't massive caloric restriction. We don't want you eating 500, 800 calories a day. We do want you to sort of maintain that, that metabolic balance. So can you take the Keto Max and the Keto Cream? Absolutely. You can definitely add the Keto Cream in. I do encourage both. I actually do encourage adding that Keto Cream into your coffee in the morning. And then the way I generally do it is I have the Keto Cream, and then about an hour later when I'm at work, I'll have my ketones at my desk and continue with that intermittent fasting. So ketones and eczema. That's a great question, actually, and interestingly, this has been a week with a lot of people coming in with some skin conditions. Some people talking about keto rash, some people talking about eczema and some other skin rashes that they've been having, if keto would be helpful. So yes, absolutely. When we see things like eczema or psoriasis, those are inflammatory skin conditions. And so right off the bat, if we look at some of that research and that evidence, we know that ketones are anti-inflammatory. They impact the body's production of certain chemicals called interleukins, cytokines. And so when I talk about inflammation, I mean that inflammation we can't see. It's systemic inflammation. So we have these pathways in the body that encourage the production of these inflammatory molecules. And we do know that that beta-hydroxybutyrate can actually inhibit that inflammatory cascade. So we have seen benefit when it comes to inflammatory skin conditions, taking exogenous ketones, but also when you start to follow a ketogenic diet. So I like to pair those together because we do know that when you start a ketogenic diet, you're not necessarily getting into ketosis right away. So I do add those exogenous ketones in so that you can actually have benefit from the beta-hydroxybutyrate. And I had a follow-up yesterday actually with some skin conditions and skin rashes that have decreased substantially with exogenous ketones in the beginning of a ketogenic diet. So yes, absolutely, there could be potential benefit. So it would be worth trying that. So are ketones safe with someone with seizures? Love that question. So absolutely yes. When we look at the history of the ketogenic diet was started by a neurologist to treat seizures in children with epilepsy. And the diet started to lose favor a little bit when the drugs came out, but we still use the diet today for people who are drug resistant, and it's still successful. The question, I believe, was, can you do ketogenic diet if you're taking the drugs? Again, you have to work with your neurologist. If you have any medical condition, your doctor has to tell you that it's safe for you to take, but there shouldn't be any interaction if you are taking medication for seizures. What I do suggest, if your doctor has said it's safe for you to take, what I would suggest is to take them away from each other. So just give yourself a 2-hour window on either side from taking medications and from taking your ketones. So a few questions on inflammatory conditions again. So I have some questions on ulcerative colitis and some questions on arthritis. So I started to talk about the anti-inflammatory component of the ketogenic diet and beta-hydroxybutyrate specifically. So when we look at inflammatory conditions like UC or arthritis, we know that you could have potential benefit because of those anti-inflammatory properties. There are some really interesting studies looking at inflammatory bowel diseases specifically and the benefit that beta-hydroxybutyrate can have on your overall gut health. There are some studies that show that it will actually encourage the production of healthy gut bacteria. So not only could it play a role in the inflammation in the gut, but it actually could encourage healthy gut bacteria, which is essential, obviously, when you have an inflammatory bowel condition. And I'm going to tie this inflammation picture. I saw a question about Sjogren's a little bit earlier, so I'm going to just tie that into autoimmune conditions in general, because I do get a lot of questions about autoimmune overall on the lives. So I'm going to tie that because Sjogren's is an autoimmune condition. So the first thing I always say about autoimmune, often when somebody is diagnosed with an autoimmune condition, they're told that there's no cause. We don't know what caused it. And then it turns into more symptom management, trying to manage the symptoms of your condition. But what we do know is that most autoimmune conditions are generally brought on by a period of stress. Oftentimes, most of the time, I'd say 95% of the time, when someone develops an autoimmune condition, they can tell you the stressful event that occurred leading up to the diagnosis of that condition. What we also know is that underlying autoimmune, and I want to tie chronic fatigue and fibromyalgia in there as well, in case we get some questions on that later. Underlying an autoimmune condition, we have stress, we have inflammation, we have mitochondrial dysfunction, and we have low BDNF. So I'm going to go through all of those. So we know that when we have a stress response in the body, we create all of these things called free radicals that cause oxidative damage in the body. And what we have found with beta-hydroxybutyrate is it actually helps your body in its response to stress and managing that free radical response and managing that oxidative stress. So there could be benefit there managing the oxidative stress that's underlying that autoimmune condition. We also see underlying inflammation, which is what I talked about a little bit earlier. There is a lot of systemic inflammation in autoimmune conditions, so it's key to manage that inflammatory component. And beta-hydroxybutyrate, and in autoimmune, I really do encourage pairing the exogenous ketones with the ketogenic diet, so I like both of those things together. We also see mitochondrial dysfunction. So what does that mean? So the mitochondria, we have it in every cell in our body. It's the powerhouse of the cell. So think of it like your body's little generator. And when the generator stops working, we don't produce the energy we need to function. So what we see underlying autoimmune condition is, what we see with that underlying autoimmune condition is mitochondrial dysfunction. So our body's generators aren't working. And what they have found is that beta-hydroxybutyrate can actually improve mitochondrial function. And then the last one that we see with autoimmune and specifically with fibromyalgia is a change in something called BDNF, which is a brain-derived neurotrophic factor. We also see that highly linked in Alzheimer's and cognition and mental health. And essentially what happens is as we age, this BDNF declines. BDNF is also essential for new neuronal connections in the brain. And what we have found is that beta-hydroxybutyrate can actually improve the production of that BDNF. And interestingly, intermittent fasting is another way to really improve that BDNF as well. So most of my autoimmune patients are taking ketones. I'm encouraging them to go keto, and I'm always having them incorporate intermittent fasting because we want to manage all of those things. And we know that the reboot and the fasting will also impact the inflammatory cascades as well. So those are things we definitely want to incorporate. So again, ketones and exogenous ketones and the ketogenic diet will not cure your autoimmune conditions, but there are things that you can do underlying that might be of really great benefit. So can this help with ADHD? I'm going to tie that into autism as well because I saw the autism question a little bit earlier. So the interesting thing that they have found with autism and ADHD is that the brain waves of those children are similar to the brain waves of children who suffer from epilepsy. And as we know, the ketogenic diet was created to manage epilepsy in children, or manage seizures in children with epilepsy. And what we have found is that there is a neuroprotective effect of beta-hydroxybutyrate. It's actually very calming to the nervous system. And they suspect that this impact on that nervous system is why we see such beneficial changes in behavior in children with ADHD and in children with autism, because it's having that same impact as it does on children with epilepsy. So there could be overlapping benefit in that way. I do always reference the Charlie Foundation if you're looking for some really great information on autism and ADHD. The other component to this is the brain's ability to make use of ketones as a fuel source. I'm going to tie this a little bit into Alzheimer's as well. Anytime we have cognitive impairment, brain trauma, and we look at the brain's ability to make use of sugar or to make use of ketones, the brain's ability to use sugar is impaired, but the brain's ability to use ketones is not. So it's a very great source of fuel to the brain. And when the brain is presented with both glucose and ketones, it preferentially chooses the ketones as its fuel source. So yes, there are some really great options there as well. So how long, I saw a little bit earlier, some questions about hormones. So can you take ketones and transdermal human growth hormone at the same time? Yes, you can. Hormone replacement should not be impacted at all by exogenous ketones or a ketogenic diet. In fact, we see improvement. So for whatever reason you're taking HGH, you could be deficient or for health optimization, whatever that reason might be. But no, we don't see any negative interactions with ketones and hormone replacement therapy. So multiple sclerosis, that gets tied a little bit into, I talked about autoimmune a little bit earlier and some of those underlying principles when I was talking about fibromyalgia and chronic fatigue. So just rewind a little bit, and multiple sclerosis will also fall into that and has a lot of those underlying components that contribute to symptoms. Again, I do like to reiterate that exogenous ketones will not cure any medical condition, but there could also be potential benefit due to the neurological benefit we see with beta-hydroxybutyrate as well. So if your doctor has said it's okay for you to start, then absolutely that could be a viable option to help manage some of your symptoms and optimize your health overall. So someone was asking about ketones making them nauseous, and they're new to it. So I don't know if that's a ketogenic diet or exogenous ketones on their own. But if they are making you nauseous, overall, generally your body is just adapting. It's not uncommon to have some digestive upset initially. So if you're finding you have a little bit of digestive upset when you start, then I suggest taking a lower serving, so just maybe a quarter pack or a half of a pack. So just lower how much you're taking, and then once your gut is able to tolerate it, then slowly increase to a full serving. I do encourage taking ketones on an empty stomach, but if you can't do that, then I encourage taking it with a higher fat meal. So some avocado or something like that, and see if that helps a little bit while you're adjusting. So some questions about alopecia, that again would fall into, will fall into some of the autoimmune components that I was talking about a little bit earlier. So blood pressure problems. So I'm assuming the question is, can exogenous ketones help with your blood pressure? Are there any detriments to taking, to following a ketogenic diet if you do have concerns with your blood pressure? So again, if you have any medical condition, you've got to check with your healthcare provider. But there's some really great research right now looking at things like waist circumference, blood pressure, cholesterol, and the role that the ketogenic diet can play in this space. And what we're finding is that we're seeing improvements in blood pressure overall, improvements in cholesterol levels, a decrease in that waist circumference, which is very important, since when we have that waist circumference, we obviously know it's that visceral fat that surrounds the organs and can increase your risk of metabolic syndrome. So these are things that we really do need to manage, and the studies are showing really great benefits with beta-hydroxybutyrate when it comes to these specific conditions. So again, I'm not going to, we won't say that it will cure any medical condition, but there could be potential benefit. So the next question I saw was on thyroid. So the next question I was seeing was thyroid. So I get tons of questions about thyroid. I find that this stems a lot from when you Google a ketogenic diet, often people will say ketogenic diets will throw off your thyroid hormones. But the problem with that is that won't happen unless you follow what they think is a ketogenic diet and you're doing it incorrectly. So oftentimes when someone says they go keto, what they've really done is taken out the carbs. They're still low fat, and now they're just eating chicken and lettuce all day long. And so you're not getting the fats that you need, and you need your fats in order to create healthy hormones. So we have to consume the fats for our body to produce hormones efficiently and effectively. So if you're low fat, low carb and calling that keto, I do see disruptions in all hormones overall. If you're getting those healthy fats in, then no, we shouldn't see any disruption in your thyroid hormone. And we haven't seen any disruption or evidence to show any negative effect with exogenous ketones either. So no, so again, if you have a medical condition, talk to your healthcare provider, but there could be benefit there. Also, if there's an autoimmune thyroid condition, I talked about autoimmune conditions a little bit earlier, so that there could be some potential benefit there for you as well. So more questions, lots of questions on epilepsy and high blood pressure. So I answered those a little bit earlier. So feel free to just go back a little bit, and I did answer those as well. So the question is, what if you're not losing weight as quickly with Prove It? So I actually love this question, and I always like to address this question, so I'm always happy when somebody asks that. I think it's really important to address the weight loss component. So the first thing I like to say about that is it's important to remember that exogenous ketones are not a weight loss supplement. That's not what they are. But we experience weight loss because of the positive benefits that it has on our insulin levels, our insulin sensitivity, our blood sugar, our hunger and satiety hormones, so our appetite, the impact that it has on helping to reduce our body fat but increase our muscle mass. And so we see weight loss, but really I like to call that body composition change. When we introduce, that's why we see weight loss when we introduce the exogenous ketones. But I always like to remind people, and I had a patient ask me this as well, and I said, I can absolutely give you a crash diet that will, or something that'll cause you to lose weight drastically in a month. But most people have already done that, and then you'll be right back where you are in 6 months. What you want to do is rebalance your body. It didn't take you a day, 2 weeks, or even a month to get to this place that you're in now. It took you years. And if it's weight that you want to lose, it took you a long time to accumulate that weight overall. And so you have to give your body time to heal and adjust. And there are other things that can impede weight loss. So gut dysbiosis, inflammation, all of those things can have a negative impact on your weight. So often you have to give your body time to heal, for the inflammation to come down. So really it's just about patience. And then you also have to start investigating other things. Are your hormones balanced? Is your thyroid balanced? Those things that can also impede your ability to lose weight. It's really important to make sure that you're addressing those things. So adding the exogenous ketones in is essential, and you have to realize that there are things that are being healed and changed internally that you can't necessarily see, but you also have to make sure that you're managing other health concerns that might be negatively impacting your weight overall. But just be patient. If you're doing the right things, if you know you're doing all the right things, all of those things are balanced, then you will see the goals that you're looking for. So what if ketones make somebody sleepy? I've heard that a few times as well, and a lot of people saying that they sleep really well when they start exogenous ketones. So the first thing is to make sure that you're not experiencing a little bit of keto flu. So if it's making you feel tired, somebody mentioned headaches a little bit earlier as well. So if it's making you feel tired or you're getting headaches, you want to make sure that that's not keto flu. And essentially the keto flu is telling you that you're missing some nutrients. You're missing some magnesium, you need to get your electrolytes back in. So the first step, if that's happening, what I usually say is that tells me what your nutrient deficiencies are. So it tells me if you're low in magnesium, which most of us are, and then because the ketogenic diet and ketones can act as a bit of a diuretic, you might lose some of those minerals, and so now we've lost a bit too much magnesium. So put some salt on your food, get your electrolytes in, introduce some magnesium at night, usually about 200 to 400 milligrams before bed. And that should be sufficient to help manage if that's more of a keto flu symptom. If they're often also pairing the exogenous ketones with diet, you do have to give yourself time as well. If they're transitioning into a ketogenic diet, there will usually be an initial period of fatigue as your body kind of transitions from using that sugar for fuel to using fat as fuel. So eventually you kind of have to be patient as your body makes that switch to a new fuel source. So sometimes you will see a little bit of fatigue. But then eventually that does resolve. So give yourself some time, about a 2-week period, and then make sure you're getting all of those minerals back in. So what type of diabetic should and shouldn't take ketones? It's also a great question. So this is the thing. So when it comes to diabetics, I'll talk about type 2 diabetics first. So essentially what you have to make sure is that you're controlled diabetic. The concern is diabetic ketoacidosis. If you have insulin in your system, this should not be a concern. Insulin will have a negative feedback response on ketones. You should not be able to go into diabetic ketoacidosis. However, what I do suggest for type 2 diabetics is you need to be diligent in monitoring your blood ketone levels as diligently as you monitor your blood glucose levels, and you need to be a very well-controlled diabetic. You're on top of your medication, you're on top of measuring your blood sugar and your blood ketone levels, and the same thing goes for type 1 diabetics. So the type 1 diabetics who don't produce insulin need to be much more cautious. They need to, again, make sure that they are controlled diabetics, they're getting their insulin as needed, and again, they're monitoring their blood ketone and blood glucose levels, making sure they're not getting too high. So I do encourage for diabetics that you work with a medical practitioner who is well versed in keto and exogenous ketones, so they can help you and make sure that you're doing it properly. So I just keep seeing the questions about MSG. I think you're asking if there's any MSG in the Keto Max products or the Prove It products. The answer to that is no. There's no MSG in any of the products, so you don't need to be concerned about that. Lots of questions about blood thinners. So everyone, a lot of people are quite concerned about blood thinners, and I saw a few other medications listed as well. So generally, exogenous ketones in the ketogenic diet are quite safe when you're on medication. You do have to work with your healthcare provider, and as I said earlier, you do just want to make sure that you take them away from each other. So if you're on blood thinners or anything like that, there shouldn't be a negative interaction between exogenous ketones and blood thinners. But if there is a concern, then, and it shouldn't impact your body, your clotting abilities or anything like that, if there is a concern, make sure you just take them away from each other, 2 hours on either end. So is it possible for ketones to cause weight gain? So no, exogenous ketones in the ketogenic diet shouldn't cause weight gain. Some people will experience initial water retention. And so essentially that's a sign, again, that you need more fluid, you've lost some minerals. So often people will retain fluid a little bit initially, just sort of as your body moves into a new balance and starts to learn how to make use of those ketones. So if you feel like you're retaining water, my suggestion is, again, make sure you're getting your electrolytes in, make sure you're drinking tons of water, because that will help with some of that fluid retention. But no, you shouldn't be gaining weight when you start to take exogenous ketones. The only time I see weight gain with dietary changes is when somebody is already eating a high carb diet, and they hear that they understand we need to increase fats, and so now they're eating high carbs and they increase fats. Now they're high carb and high fat. That's a very bad combination. Absolutely, you will gain weight if that's what you've done. So some people won't necessarily make the dietary changes, they won't cut the carbs out, but they increase the fat significantly. You will gain weight if you do that. So you do have to find that balance. Even if you're not going keto, you do have to find that balance between the carbs and the fats overall, because again, you will see weight gain if that's sort of how you've done it. So I've seen a few more questions about blood thinners. And so I just answered that a few minutes ago, so feel free to rewind a little bit. So I did talk about blood thinners and medication overall. So another question about kidneys. So I'm assuming the concern is kidney health. Is this detrimental to your kidney, harmful to your kidneys? So we don't see any evidence at this point to show that exogenous ketones are detrimental to the health of the kidneys. We often get that question because there is a link between a ketogenic diet and the development of stones, kidney stones. And essentially when we see that, it's usually because there are some minerals that are lacking, and specifically potassium. Potassium is something that potassium supplementation can actually help to mitigate that risk of developing stones. So if somebody is concerned about stone development with a ketogenic diet, they can just add in some extra potassium supplementation, and that should be all you need. But again, we don't see any detrimental health impacts on the kidneys. Even with a ketogenic diet, there's some really great evidence looking at individuals with kidney disease who are on dialysis, and they actually do much better when they're keto versus not. So there's some really great research showing the benefit of the ketogenic diet and the health of kidneys and the health of your kidneys overall. So, and it's true, so somebody is talking about healthcare providers' education. So that's true. We do get that question a lot. What happens if your doctor is not well versed in keto? They don't know much about keto or exogenous ketones. They're telling you that is bad for you or that high fats are bad. And the problem is it's really hard for you to be the person to change or shift that mind frame. You can let them know as best you can. you can give them the information, but generally my suggestion is if you want a doctor who's going to support you on your keto journey, you have to find somebody who's well-versed in keto overall. So I've often suggested switching doctors to a lot of people and being your own health advocate and finding somebody who can support you and somebody who's educated or willing to see the research or become educated on the topic. But if you're getting a firm no, it might be time to look elsewhere so you can be supported by your healthcare provider. So the last question I'm going to take is going to be on hormones. I've seen some questions about endometriosis, and so what we often see with endometriosis, and same thing with fibroids or ovarian cysts, is we see estrogen dominant, so we see an imbalance in the ratio between estrogen and progesterone. And there are some really great studies looking at the role of beta-hydroxybutyrate in hormonal imbalance. And there have been some benefits in terms of regulating your cycle in women with PCOS, and its role on ovulation, helping to bring down some of those male sex hormones which are often elevated, and in endometriosis as well. We also need to be managing the inflammatory component. So Prove It and keto products are not going to cure you of any medical condition, but you may find that because of some of those other anti-inflammatory components, the hormonal impact, that you may have some symptom benefit from adding that product in. So again, talk to your healthcare provider, but you may experience some benefit from adding that into your routine. So I know I missed a lot of your questions today. Hopefully I got to most of them. I'm seeing a few that I answered a little bit earlier, so hopefully you can just sort of rewind a little bit. I lied and answer one more question. One more. So the question is, where should I start? And I'm actually glad that you asked that. I want to address that before I go, because some people can be very confused. If they're not making the dietary changes, should they take exogenous ketones? How do they start? What should they do? And so my first piece of advice is to start. Even if you're not quite ready to make that dietary change, that's the whole point of exogenous ketones, so you get the benefit of them. Even if you can't quite make that lifestyle change, you will still experience benefit. So I encourage taking them. If you're new, start with 1 serving first thing in the morning on an empty stomach. And that's how to start, just that 1 pack. Eventually, as you get used to it, you will start playing around with it. You'll find different points in your day that you find might be a bit more beneficial for you, or you might want to move it around, and that's fine. But if you're new, start first thing in the morning on an empty stomach, add in your first serving of ketones. And then eventually the next step, again, if you're not quite ready to make a dietary change, incorporate that intermittent fasting. So add in your ketones, start intermittent fasting, and then add in some keto cream. And at the very least, and those few things alone, even if you don't make any dietary changes, will make a significant difference from an inflammatory standpoint, from a cognitive standpoint, your focus, your energy. So I'd say that's a great place to start. So start ketones first thing in the morning on an empty stomach. Once you become used to that, incorporate that intermittent fasting, and then add in some of the keto cream in that intermittent fasting as well. And that's a great place to start. And then you can build from there as you become more familiar. So I hope that answered all of your questions. I know I've missed a few. Hopefully I got all of them. I'm hoping most of you will be at Keto Academy at the end of September. I will absolutely be there to join you, so feel free to come and ask me your questions, come and say hello, and enjoy the rest of your week.